Hi, everyone. It's Dr. Kyle, and I want to take a few minutes tonight to talk to you specifically about something that has become extremely commonplace in our society, both over the last couple of years, but especially over the last couple of months as we've shifted more and more toward prevention of exposure from corona, and that's hand sanitizer. Now, if you remember years ago, hand sanitizer was something that was really only found in medical facilities or areas where there was a risk of infection, and more it's been placed at the front entrance of stores. It's hanging from purses. It's literally something that's available to you at almost every facility you go to. And over the last couple months, it's become increasingly so, as well as been now mandated at many facilities, workplaces, clubs, social organizations, things like that. And the reason why, of course, is because everyone is worried about corona. Now, I want to start off with a couple things discussing the importance of understanding what corona is or how it spreads. The first is that one of the first things that we knew, even going back to the studies coming out of Europe several months before, was that this is an illness that spreads predominantly through respiratory droplets in the air. And it is not something that spreads very readily through contact. So there's an argument to be made, and I believe that the excessive amount of wiping down that we're doing, instant hand cleaning and wiping of surfaces, really is not doing much to stop the spread of this particular virus. You can make the argument for other ones, but not for corona. So remember, this is a respiratory illness spread through droplets in the air and not necessarily through touch. And a lot of the cleaning that's being done and the excessive wiping is done purely out of fear, without a lot of science basis to it, and to look to litigate, to minimize the risk of litigation in the public eye. So first and foremost, this is not the most effective way of spreading or preventing the spread of coronavirus. The second is that these hand sanitizers initially were developed for hospital settings or settings for healthcare workers that were dealing with patients with immunocompromised systems. And it was a quick way for them to quickly clean off their hands or any other surfaces when it wasn't available to have a source of water and soap with us. In fact, still today, the CDC says that the best way to avoid this or to wash your hands is not with a hand sanitizer, but it's with normal soap and water for 20 seconds of washing. So keep that in mind as well. This is not the best way to clean your hands. Soap and water is when available. In fact, as recently as the last couple of years, the AMA itself, the American Medical Association, said that these type of hand sanitizers should only be used in a hospital setting. And the reason they gave was because when it's used excessively, it allows for the spread of other more dangerous bacteria like C. diff and MRSA that are much harder to tackle, and it increases the spread of bacteria or antibiotic resistant bacteria, in fact. So the more we use these things in our daily lives, the more we're actually kicking the can down the road with these more dangerous bacteria out there to our health. Now, with all that being said, I also understand that there are mandates in place right now. And so many people are finding that they cannot avoid the use of it or the exposure to it. So here's some information I want to share with you when you have the choice, what you should look for, what you should avoid to make sure that the stuff that you're using, that you're putting on your body, is at least the safest or least toxic available. Remember, your skin is excessively absorbent. Things that you put on your skin will be absorbed in, so it's very important that the things that you're putting on your hands, especially, are not full of toxins that your body has to deal with as you're trying to avoid this. So the main things I want you to look for specifically to avoid, there are a list of things that are available now that were proven by the FDA only a couple months ago, saying that it's no longer allowed to be put in, but things like triclosan, which is one of the most popular ingredients for many, many years, is a known endocrine disruptor. Look for anything that is SLS or SLES, that's sodium lauryl sulfate. Those, again, are cancer-causing agents. They're carcinogens, very common in hand sanitizer, although it's still being allowed. The studies show that this is not safe. PEG, or propyl ethylene glycol, is a gasoline derivative that's put into hand sanitizer that, again, is dangerous for you. There's a long list of these chemicals that are still being used commercially in some of the biggest brands that are dangerous for your health, especially when you put them on excessively. The best tool you have right now is in most of your pockets. It's your cell phone. If you are looking at the ingredients and you see something you don't understand or you don't see, please do a quick Google search and look at the research to understand what the effects might be for that. Every one of these formulations tends to be a little bit different with their active and inactive ingredients, but it is all listed on the label for your knowledge. Take just a moment and do the research to figure out what you're putting on and into your body. It's really that simple. Here are the things to look for, though. Number one, you want one that is an alcohol-based hand sanitizer. The FDA says that if it's alcohol-based, it has to be at least, I believe, 60 or 65% alcohol. So look for that, of course. The ingredients that you will want to see on there that are safer, there's things like glycerin. This is involved in many of the homemade products that are out there. So you can actually look and find recipes online that are homemade where you control what goes in, but it's still as effective as anything that you would buy off the shelf. Think hydrogen peroxide is a very popular and less toxic ingredient to put into your hand sanitizer, so you can find those commercially available as well. Even essential oils like thyme or oregano oil are excessively effective at preventing bacteria, virus, and fungal spreading. And while essential oils are something that many people will look at and say that it's not science-based, the truth of the matter is there is a mountain of science of how effective those oils are at preventing these dangerous pathogens. So much so that in the US, because we're not allowed to put antibiotics into the feed of chickens as they grow, big companies, including Purdue, which even had a commercial that talked about this, big companies that make chicken every year, they use thyme oil in their feed in order to prevent illness in their chickens. And they do that because it is scientifically proven to keep them healthier. And the same is true for you. Those same oils like oregano and thyme are very effective at fighting off bacteria, funguses, and viral bodies. So there are healthy options out there. Do the research for yourself. Look what you're putting on the skin of your own hands or the hands of the people you love and your children, and you can have healthier alternatives for this. But remember, still, the best thing to prevent this, to prevent getting coronavirus or having adverse effects, is proper functioning immune system and proper health. It's not avoiding contact, and it's not using a certain type of hand sanitizer. It's making sure your body is prepared to fight any virus that comes your way going forward. Have a wonderful day. If you have any questions or comments, remark below. I'll do my best to answer. Have a wonderful, blessed day and a happy and healthy Friday.